Formed in 1986, the Certification Board for Diabetes Care and Education is the national certification board for the Certified Diabetes Care and Education Specialist, CDCES credential. The CDCES was formerly known as the Certified Diabetes Educator, or CDE. There are over 19,500 healthcare professionals holding the CDCES credential. The CDCES is a multidisciplinary credential and is held by registered nurses, advanced practice nurses, registered dietitian nutritionists, pharmacists, physicians, PAs, and other health professionals of the diabetes care team. CDCES certification is accredited by the National Commission for Certifying Agencies.
I attained my certification as a diabetes care and education specialist in 2003 as part of a job requirement. It wasn't until several years later that I realized the value of this credential when I started to receive speaking engagements as well as a great job opportunity. It's clear to me that I would not have had the career advancement if it was not for this certification, especially in my field, which is exercise physiology. I know that having this credential makes me more credible, and it has given me personal and professional growth.
I have no doubt whatsoever that obtaining the CDCES credential has been one of my best professional decisions. I feel so much more fulfilled professionally because my patients tell me that they feel more empowered after their visits with me. I like to say that I'm treating one patient but actually impacting 2 generations. Coincidentally, my practice has benefited financially too. CDCESs are critical to the care of people with diabetes. If you are a healthcare provider who is involved in any way in the care of people with diabetes, I urge you to consider becoming a CDCES. The only way that you can do it better than referring your patient to a CDCES is to become one yourself.
The journey to become a diabetes educator is a very personal one. For me, I had the privilege of seeing excellent diabetes educators care for my family members, and while I was in the role of caregiver, they taught me how to care for my loved one. It was amazing to see the depth of knowledge that they brought, the education they provided to us, the resources, the tools, the tips and tricks, and the emotional support as we cared for our loved one with diabetes. There were many hard days, but we always knew we could contact our diabetes educator for support, guidance, and advice. I was inspired when I became a nurse to pursue becoming a diabetes educator myself because I wanted to give back in the same way that we had received. I wanted to provide this knowledge and skill to the patients that I worked with and help them understand that they could live long with diabetes. It's a privilege to work with patients, and I'm so grateful for the diabetes educators that inspired me along my own personal path.